Right, well, coronavirus numbers across the world continue to climb, with the US now overtaking Italy in case numbers overnight. More than 85,000 Americans are infected with the disease. Sky News political reporter Annalise Nielsen joins me tonight from Capital Brewing in Fyshwick, Canberra. Well, it's good to see you are out of the office on this occasion, and I know you're there and you're doing all the right things in terms of social distancing, but you want to highlight, and when we get through some of this detail at the top, the impact on small business and some of the innovative ways they're all trying to cope. But let's start with the announcements today from the Prime Minister, Annalise, and we'll go through some of the numbers as well, actually, before we do that. 249 new cases in Australia reported today. That takes us over the 3,000 mark. It was only a couple of days ago. We're at 2,000, now we're at 3,000. Deaths are at 13, and good to see, 200 plus people have recovered. The CMO, the Chief Medical Officer, really made the point, underlined it in that press conference today, didn't he, that our big infection numbers are coming from overseas, hence the big move today to quarantine Australians returning home.
That's right. There was the emphasis put on the fact that 2/3 of the cases in Australia have come from overseas, and that's why they're really focusing on these visitor numbers now. But if you look at those numbers that you've just mentioned, there is some comfort when you compare them to the global numbers, which we have here: 530,000 confirmed cases around the world, 24,000 deaths, and 124,349 recovered. What that shows is that our mortality rate is much lower than the global trends, but we haven't had the same recovery rate, which means we are in the early days of this. This is still early in Australia compared to what we've seen in the rest of the world. And so this move from the Prime Minister to quarantine anyone flying into Australia now is a concerted effort, because they know that those who have been overseas for this period of time are more likely to have had a high risk of exposure to coronavirus. They're more likely to have it, and so that's why we need to be doing that advanced screening. I know you've been following that very closely about making sure that we did up those standards, because people have been wondering for weeks why there haven't been temperature tests at the airport. As you said, the Prime Minister was saying that people were required to self-declare on those forms and to self-isolate. But the question has been around the policing of that, also around people just flouting it, not taking it seriously. A woman in Sydney has been fined because she was caught leaving what should have been self-isolation twice in just a week. It is exponential, these figures of people are exposing themselves to just 3 people instead of 1 when they go out. Those figures can blow out into dozens, hundreds of coronavirus cases, and this has also been exacerbated by these cruise ships. That one cruise ship in New South Wales, it's estimated, could be responsible for about 10% of the cases that have now spread into the community. We still have cruise ships circling Australia with Australians on them. They needed to do something, and this hotel idea is quite innovative, but it will come down to the states to manage the cost, which will be significant but very necessary.
Well, look, we talked about it this week. We talked about with representatives from the accommodation, the hotel sector. I think it's something they have been in conversations with government for some time. I think governments are reluctant to go this far. It seems draconian. I don't think it's draconian. I think it's absolutely common sense. It should have happened a long time ago, if I'm absolutely bloody honest, because I think you can trust people coming back to Australia to do the right thing. If they're feeling okay, and they think they're invincible and they're out and about in the community, and the risk is not so much to them, it's to older Australians. You said you took comfort in those numbers. I just want to make the point, though, with 3,000 cases, and some of them obviously will be very mild, most of them actually, 80% of them will be relatively mild. We start to move much beyond that in terms of infections. We are getting close to the amount of ventilators we have available, the intensive care beds we have available. That's the risk, not so much the gross number of people infected, but the number of people that need that higher level serious support. We know the United States too, 85,000 infections and 1,300 deaths, 80 in Italy and 57,000 in Spain. Their deaths are very high as well. I want to play a grab today, a press conference from President Trump. There's been a lot of debate over there about a sudden spike in their numbers. He says it's not so much there's a high rate of infections per se. He's saying we're just testing a lot of people. No, we haven't got that Trump grab. Can't show it for you, can't play it for you. But he's basically saying it goes down to how prudent, Annalise, how prudent they are in testing, that they're testing so many.
That is exactly what he's been saying, but there has been a bit of disagreement among experts about that actual figure. Right now, South Korea's actually got the highest rate of testing, but that's because they had an enormous spike in coronavirus cases very early on, so they had to take a very drastic action. Quite interestingly, it was actually through a lot of the mega churches there that this coronavirus spread so quickly because they were in quite close contact. So this is something that just affects every country differently. Some countries have higher rates of smoking, some countries have higher rates of obesity, and those are all things that obviously compromise you when you're infected with anything like the flu, and especially something as serious as coronavirus. And so there is something to be learned from all these countries, but we also have to take them quite uniquely for what is challenging Australia. That's why the states are saying in Australia that we need to treat it differently, as we would in the Northern Territory, where there's in remote Indigenous communities with poor health outcomes. They've had their first case reported today in a remote Indigenous community. That's a real cause for alarm. That needs to have different treatment. To New South Wales, which is very populous, has a lot of people living very closely together, and has unfortunately had those cruise ship participants come out into their community as well.
Right, well, tell me where you are now. This is a small business, Capital Brewing in Fyshwick, Canberra. Obviously, they make alcohol out there and they've got some nice seating areas. So it was a place that people would go out there, particularly this time on a Friday night. Clearly, that's no longer allowed. So how do they keep the money coming in? How do they keep their staff on the payroll?
Well, they're doing it tough like everybody else. They've had to stand down 36 staff. They're saying that they hope that they can come back on when this is all over. They have used a few of their stills to start making pure alcohol that they can then pass on, which is being used to make hand sanitizer, but they're not doing this for profit. It's done at cost, and so that's not really helping their bottom line. They're doing delivery, but a lot of their beer used to be sold to restaurants and pubs, and that's no longer a profit line for them, and so they're trying to do as much business as they can. There's been a few people come at an appropriate social distance to pick up a few cartons today, but they're doing it tough like everyone else. And when I spoke to the Managing Director, Lawrence Kane, at a distance yet again this afternoon, I will make that point, he was saying that one of the things they're finding the hardest is just dealing with the uncertainty.
The uncertainty is crushing. Like, we can't plan for anything. We don't know what's going on. The messages are really confusing. So yeah, the sooner we can get certainty on what's happening, the better. But I guess everyone's in the same boat, so we're just rolling along.
So Peter, I know you're a big supporter of small businesses. We just want to be using as many opportunities while we still can to shine a light on the ones that are trying to do the right thing, are really trying to persevere through this and keep as many people on the books in a safe way. And so that's why we're here today. We'll be doing this as much as possible to try and support local businesses right through this until the end, because there will be an end.